herself to be an intelligent young woman, well capable of achieving her goals. Yet in the bare few weeks she had so far completed of her training, so very much had been made of the probationer end-of-year exams that they had become an unnerving bogeyman in her mind. Still, she had little time to reflect upon her new friend's cheering advice, for Mr. Darcy, denied the honorific of doctor, like any proud surgeon, had moved on. He opened the meat of the lecture with the words, "So, kindly take out your pens, and we will address the matter of calculating the speed of ventricular contraction." This opener signaled the beginning of these diligent student nurses' intellectual trials. Elizabeth felt that she barely had time to draw breath between one onerous, difficult of comprehension concept before the introduction of the next. Her neighbor appeared less affected, seeming to take the onslaught of a continuous stream of information in her stride. But then, Elizabeth considered, having already covered the course material once must surely be of significant assistance in mastering it upon encountering it a second time. All trials must come to an end, however, or so the Son of Man, born to suffer, must sincerely hope. Finally Mr. Darcy brought the lecture to an end, winding down with the words, "And there you have it, you young women aspiring to the honor of being able to describe yourselves as Pemberley's trained nurses, a relatively easy introduction to this course of lectures upon cardiovascular structure and function. I trust that you all enjoyed it, and will be able to reproduce the material presented here at will in the future, not only reproduce it, indeed, but analyze, debate and counter-argue it. I expect no less of the young women studying the nursing profession, although I must confess, I am sometimes gravely disappointed. I trust it shall not be so this time." Good Lord, thought Elizabeth. The chap was brilliant, obviously, and inarguably good-looking, with it. And quite as rich as Croesus, if Mary Crawford were to be believed. But was it really necessary that he be quite so transparently aware of these things? As Elizabeth wondered about this, Darcy raised his head, and by chance, by some evil chance, she half thought, caught her eye again. But fortunately, it was once more only for the briefest moment. And yet still, she thought reflectively, she could quite well understand why half the nursing staff of the hospital, or so Mary Crawford had alleged, were cherishing a secret passion for him. Fetching, if positively not sufficiently so to compensate for his evident superiority complex. In any case, he observed, oblivious to Elizabeth's mental commentary upon his level of pulchritude and temperament, "Are there any questions I can assist you ladies with? We have about 5 minutes before the official end of our tenure of this lecture theatre. Anyone?" In fact, Elizabeth had found herself a little lost at one point in this self-satisfied young wonderkin's disquisition. A couple of other hands had already risen, she lifted her own to join them. In surveying his audience, it was Elizabeth that Mr. Darcy nodded at, and then pointed out for further clarity. "Yes. You, nurse. What issue are you having difficulty with?" It was not especially pleasant to be the first student of cardiovascular function singled out for interrogation. But Elizabeth was a young woman of strong spine and some social boldness, and she took a breath and plunged in, determined. "Thank you. It's just that I'm not quite clear on the role of the Purkinje fibers in stronger chamber contractions, and the relative order of increased contraction versus increased stroke volume." Mary Crawford turned slightly, and gave her a look, of what kind Elizabeth was not sure, precisely. Certainly she was not quite sure that it was an approving type of look. Mr. Darcy, however, was gazing upon her with the most completely neutral aspect that Elizabeth had ever beheld. "Well, miss, to begin with I would advise you to approach the heart as an integrated whole. This is very important. I take it you are conceiving of some kind of vicious cycle otherwise, with increased contraction causing greater stroke volume, and greater stroke volume increasing contraction until." And so he continued, demonstrating by his sketching out the details that he perfectly understood the nature of her misapprehension. At the end of his setting it out, the entire issue was a great deal clearer to Elizabeth. He finished by saying, "I hope that helps, but if not we can explore the issue at greater length in the next lecture." Elizabeth was able to reply, "No, I feel that I have a much better grasp of the subject now, thank you." He nodded at her with a perfect lack of interest, and moved on to the 2 or 3 other girls who had put their hands up. Meantime, Mary Crawford dug Elizabeth in the ribs with one sharp elbow, and merely grinned when Elizabeth turned to her with an inquiring eye. In short order the lecture and subsequent questions were over, and the heaving mass of young St. Pemberley's probationers filed out of the lecture with a great and concentrated thankfulness. Mary Crawford was just ahead of Elizabeth in line, but turned back to nudge at her again with a grin, as they slowly made their way to the exit. "What is it?" Elizabeth asked, mystified as to what the other girl was so very amused about. "I'm impressed, that's all," Mary Crawford said cheerfully. "Why, what an inquiring mind you have, Miss Bennet." "I didn't quite understand the point, that was all," Elizabeth said, perhaps a little defensive yet with little reason. "Why would I not ask about it, when the chap invited any questions?" "Oh, not the least reason," Mary Crawford admitted breezily. "Except that not one girl in 10 in that lecture theatre understood what Darcy was speaking of any better than you. I'd lay money to it, too. But you were the only one who brought it up, just the same. All the rest are perfectly content to take it on trust, to read through their notes and regurgitate the whole entire boiling of it, the whole kit and caboodle parrot fashion come exam time." "Well, more fool them," Elizabeth retorted, a little mollified. "Oh, I don't know," Mary Crawford countered. "It's a comfortable attitude. Why should they engage themselves in endless labors not really required to do the job they're training for? Because it's interesting? Because they'll do the job better with a more complete understanding?" Elizabeth suggested. Yes," Mary said dubiously, as they exited out into the foyer of the building. "Or on the other hand, if that's how you see it, why don't you go in for medicine?" It was really the last question in the world that Elizabeth wanted to answer. Thus it was quite a relief to spot Emma Woodhouse and sweet monkey-faced Fanny Price on the other side of the foyer, scanning the area and evidently waiting for Elizabeth herself to pop up and rejoin them. Thus she excused herself hurriedly from her new companion's presence, pleasant as it had been to make her acquaintance, and made her way over to greet her pals, who, in the case of Emma at least, proceeded to tease her a little about the supposed failure of her usual erudition. "Here she is, Fan," Elizabeth's old friend and colleague greeted her, nudging Fanny ostentatiously. "This is the one who doesn't know which came first, the chicken or the egg, or the elevated muscle contraction versus the increased stroke volume." Fanny smiled shyly, lowering her eyes a little as she spoke. "Actually, I was relieved you asked, Lizzy. I've wondered the same thing myself before now, although I couldn't have expressed it half so clearly as you did. It was nice to have a bit of moral support from one of your buddies, at least," and, smiling at Fanny, Elizabeth was just about to say as much. But she had been vaguely aware for a few moments now of some familiar sound in the background of her consciousness. And now she became fully aware that it was the voice of a distinguished-looking fellow of late middle age, resplendent in a three-piece suit and gold pocket watch, holding forth to some unfortunate soul. Elizabeth was very ready to sympathize with this chap's chosen victim, for she knew exactly who he was. It was Sir William Lucas, a consultant pediatrician at her own local general hospital back home in Meryton. Elizabeth had been aware upon embarking on her probationer year out at St. Pemberley's that Sir William, a good friend of her GP father, was sometimes called in to consult upon an interesting case up in Derbyshire and further from the capital at Street Peas. Up until now, however, she had not actually encountered him. She could not help but sigh a little, and possibly even shrug, as she mentally goaded herself for complacent social smiles and a civil exchange of greetings with him, herself. That little moment of girding her loins for the task, however, caused her to tune into what he was actually saying, and his companion, too. Or at the least, the poor fellow he was talking at. Of course, very laudable indeed. These young women must be educated to the limit of their ability, and all the better for their patients, the better their comprehension of anatomy and physiology and such, do you not say, sir? Of course, we don't want to make doctors of 'em, and precious little chance of it, in most cases, would ye not say? Hey. The tone of the reply he received was dry, most dry, and possibly a little cold, with it, although still civil. Do you think so, sir? I confess myself not impartial on the subject. My sister has ambitions to enter the profession. But I must confess, to judge by the quality of questions I have fielded today, I might find it difficult to dispute the point with you as a matter of fact. The assertion that there are no stupid questions, a truism summarily disproved and sent packing this day. Sir William's companion had lifted his head to meet her own eyes as he spoke. It was the very moment that Elizabeth turned about to see whom Sir William was addressing. It was something of a shock, a nasty, cold splash of dishwater.